So mind-body connection, again, the subject of our talk. Let's consider, in addition, the evidence for a mind-body connection. We start with the broken heart syndrome. What is the broken heart syndrome? Other names for this condition include a stress-induced cardiomyopathy, an apical ballooning syndrome, or Takotsubo cardiomyopathy. So what exactly do these mean? Here we see a schematic of a normal heart, and the chamber shown in red is the left ventricle, or the main pumping chamber of that heart. In the setting of the broken heart syndrome, or Takotsubo cardiomyopathy, we see that pumping chamber is markedly dilated with thinning of the pumping chamber's wall. So this is the cardiomyopathy. Why is it called a Takotsubo? Because it was discovered in Japan, and in fact the heart's chamber does take on the shape of a Takotsubo, which is a traditional octopus trap that's been used for many years in that country. So here we have that ballooning of the main pumping chamber of the heart in response to intense emotional stress, which constitutes the broken heart syndrome. So we know the broken heart syndrome is the result of sudden emotional or physical stress. It's due to excessive stress and adrenaline release. It presents very much like an acute coronary syndrome, also known as a heart attack. So 2% of all patients who have a presumed heart attack due to their presentation with chest pain, shortness of breath, unexplained fatigue, nausea, things of this nature are found to have the broken heart syndrome. It's a diagnosis in patients who develop ballooning of the left ventricle in the absence of obstructive coronary disease. So someone seems that they're having a heart attack, they have a cardiomyopathy, we image the arteries to the heart, we're found to have no atherosclerotic coronary disease or no significant obstructive atherosclerotic coronary disease. Nevertheless, there is apical or mid-ventricular failure of that main pumping chamber, and we make the diagnosis of broken heart syndrome or Takotsubo cardiomyopathy. So just to show you that a little bit more, here we see an angiogram of that heart chamber. We've put a catheter into the heart and injected it with dye to image. I'll trace here, this is the main pumping chamber of the heart at the time when the heart is relaxing. And then when that heart contracts, we see how that chamber becomes much smaller, almost sliver-like, as it has injected that volume of blood into the central circulation. In the presence of a patient with broken heart syndrome or apical ballooning, we see a very similar pattern during relaxation. Then at the time of contraction, the neck has indeed contracted very nicely, but the apice of that chamber, or the tip, continues to have that ballooning pattern as its contractility has in fact failed. So this is the broken heart syndrome. And again, we understand that the heart is heavily innervated from the brain and from the autonomic nervous system, such that if there is a very strong discharge from the brain, from the nervous system, it can dramatically impact the heart in such a way that an individual may develop this Takotsubo cardiomyopathy. So here to see one more time, we have an 86-year-old woman who accompanied her husband to the emergency department. Half an hour into his evaluation, she reported chest pain, substernal with pressure-like quality, 2 of 10 in severity, with slight radiation into the left chest. It sounds like she is also having a heart attack. She's taken to the cardiac catheterization lab where that pumping chamber is imaged. We see that during relaxation, her heart has a completely normal shape, but during contraction, there is ballooning of a major portion of that heart chamber consistent with the broken heart syndrome. She's not having a heart attack. She doesn't have coronary artery disease. In response to her husband's illness, she is experiencing intense emotional upset sufficient to cause the broken heart syndrome in her. So today we appreciate just how strong the nervous interaction between the brain and the heart can be. Moving on, we'll discuss psychological conditioning as another source of evidence of the mind-body connection. I think everybody's heard of Pavlov's dogs. This is a classical conditioning experiment. As you recall, Ivan Pavlov lived in Russia in the late 1800s, early 1900s, and he received his Nobel Prize in Physiology in 1904 for a very curious experiment that he performed with dogs. what Dr. Pavlov would do is he would observe that when he fed his dogs with their usual dog chow, the dogs would drool. He then rang a bell, measured the stool in his dogs, and there was nothing. He then paired the stimuli of the bell with the eating of food. So he would present the food, the dog would drool, and at the same time he would ring the bell. The result of his classic experiment is that after continuing the food bell association for a period of time, simply ringing the bell was enough to get his dogs to drool. And that may seem like a very innocent result, a very simple result. It's sort of comical, and I think we joke about it a lot. But what is the significance of it? There is tremendous significance to this, as is the case with most Nobel Prize winning research. For example, we all know Einstein's equation is E equals mc squared. I don't think many of us quite know what that means, but we're certainly familiar with the equation. We know somehow this is what's governing our universe. It's something that has high impact for physics. Similarly, Pavlov's dog experiment has very high impact for behavioral psychology. So classical conditioning is pairing an unconditioned stimulus with a conditioned stimulus. So the conditioned stimulus, for example, is neutral. It's the sound of a bell. The unconditioned stimulus is very potent, for example, salivation. Again, this is a high-impact research result because it suggests the possibility for us to condition our own physiology in very deliberate ways. We can develop conditioned stimuli, very neutral, benign things, which can in our own bodies generate very powerful and real physiologic effects. And honestly, the possibilities are endless, and hence this is Nobel Prize winning research. Curiously, perhaps those who are most taking advantage of Pavlov's experiments are those leading the personal development industry. For example, here's Anthony Robbins' Unleash the Power Within, full of psychological tips and tricks to get the most out of your performance. He'll teach you how to place yourself in a certain state when needed. For example, if we need to feel very excited on command, we can generate feelings of intense excitement in our bodies. And when we do, we could, for example, clap our hands. Generate intense feelings of excitement and clap our hands. Generate intense feelings of excitement, clap our hands. Then, when we need to feel intense feelings of excitement, we simply clap our hands and feel a rush of those positive emotions which we've conditioned our minds to generate with that very simple stimulus. And it is exceedingly powerful. Here's even a more convincing experiment where this dog is injected with adrenaline. And as you would expect, in response to the adrenaline, the blood pressure rises. Now, the dog is injected with a hormone, or neurotransmitter rather, that induces a state of relaxation. And we see in response to that, the blood pressure correspondingly decreases. But now we're pairing that neurotransmitter with a sound stimulus, a siren, such that later, with adequate pairing, in the presence of that sound stimulus, even when the adrenaline is re-injected back into that dog's physiology, we see the same blood pressure decline that we saw with the relaxing neurotransmitter. So the conditioned response, the response from the brain, exceedingly strong, able to overcome and completely reverse even the effects of the injection of adrenaline. Again, we appreciate the strength of the mind-body connection and are left to puzzle at what may be possible if we could only harness this power to our own benefit. Another example, mind-body connection from the placebo effect. What is a placebo? A placebo effect is a remarkable phenomenon in which a placebo, which is a fake treatment, an inactive substance like sugar, distilled water, or a saline solution, can sometimes improve a patient's condition simply because the person has the expectation that it will be helpful. That expectation is strong enough to obtain the positive health benefit which the treatment promises to make, except that it is a false treatment. A very famous example of that comes from UCLA. Here's a story of a Mr. Wright who was in fact dying from cancer of the lymph nodes. He had orange ball-sized tumors invading his neck, groin, chest, and abdomen. Doctors had exhausted all available treatment options. Nevertheless, Mr. Wright was confident that a new anti-cancer drug called Krebizin would cure him. Mr. Wright was bedridden and fighting for each breath when he received his first injection. 3 days later, he was cheerfully walking around the unit and joking with the nurses. Mr. Wright's tumors had shrunken by half, and after 10 days more of his treatment, he was discharged from hospital. Other patients in the hospital who received Krebizin showed no improvement, and that's because the medication doesn't work. It's no longer relevant and not at all part of our clinical armamentarium. But here, a very powerful example of placebo effect where this patient's consuming belief in the treatment, although a false treatment, is sufficient for him to receive the healing benefit of that treatment. Another example, here from the journal Neurology in 2015, expensive drugs work better. Here we have 12 patients with Parkinson's disease who were told that 2 drugs for Parkinson's were to be tested. One drug cost $100 while the other drug cost $1,500 per dose. The patients were told that these drugs contain the same dose of the same medicine. However, the manufacturing processes were different. There was then the experiment was, or the researchers were testing to see if these 2 preparations of the same drug worked equally well. What the subjects did not know is that they all received identical injection of a plain saline solution. They weren't even receiving medication. It was found that the expensive placebo worked significantly better, producing a 2-fold improvement compared with the cheap one. Those patients who understood and truly believed that they were receiving a far more expensive version of exactly the same drug at exactly the same dose had a 2-fold greater response to the false treatment than those who believed they were receiving the less expensive preparation. Very compelling example of the strength of the placebo effect being a cure from the mind. The placebo effect is strong scientific evidence that we have the ability to heal ourselves. Our thoughts are powerful enough to transform our bodies if they could only be harnessed appropriately. And the placebo effect is no mystery. Mechanisms, very mundane, usual mechanisms, have been proposed to explain the placebo effect, which really does rely on psychosocial context. We have the patient's cognitions, which is their expectations, their belief, their trust, their hope. We have this paired with a conditioned stimulus, which is the act of taking a pill, and that has been paired with an unconditioned stimulus, which is the active ingredient. Of course, in the case of the placebo, the active ingredient is in fact missing, but when that is paired with the form of a pill, that's sufficient to trick the patient's mind in a way that interacts with their cognition such that the healing effect is generated and does in fact occur. So again, the placebo effect being very strong evidence for a robust mind-body connection and for what the mind-body connection has the potential to achieve in any one individual if we can simply harness it at the appropriate time. Another example of mind-body connection can be obtained from the field of heart transplantation. And this is something that's very close to cardiologists like myself and a significant part of our practice. Here we have heart transplantation, a major operation where a patient's heart can be removed from their bodies and during which a donor's heart can be substituted for that heart by attaching it to the major structures from which the original heart was removed. So here we see operations involving a heart transplant, and here we see a heart transplant patient who has survived his heart transplant, doing very well, and is in fact holding in his hand his old original heart, which was removed as a life-saving measure. So a very interesting world, transforming the lives of individuals who can receive heart transplants, represents a last treatment option for those with desperate cardiomyopathies who need life-saving therapies and whose organs themselves cannot be fixed sufficiently to allow that person to do well. Here is a very curious result in the context of heart transplant, more than a new heart. This is the story of a 47-year-old woman, Claire Sylvia, who received a heart and lung transplant from an 18-year-old boy who was killed in a motorcycle. Interestingly, she awoke from her transplant operation craving beer and with a taste for new foods, Snicker bars, green peppers, Kentucky Fried Chicken takeaway. She had never wanted beer previously, had never been interested in Kentucky Fried Chicken, awoke from her transplant operation, in fact, having developed a new taste for these things. She says in her book on this experience, I was more aggressive and assertive than I used to be, even more confident as well. I felt tougher, fitter, and I stopped getting colds. Even my walk became sort of more manly. I felt a new power that I associated with strength and vibrancy. My feminine tentativeness had fallen away. I didn't feel the same need to have a boyfriend as I had felt before my operation. She goes on to say that she dreamed about her donor. He gave her his name in the dream. They planned never to be separated in that dream. With the name he had given her, Sylvia was able to look up his family, meet the family, and learn that her donor did in fact have a strong taste for beer, peppers, Snicker bars, KFC, was a very confident individual, and always in excellent health. So we hear a very convincing story of a woman who has received someone's heart, and as a result of receiving that person's heart, also obtained many of the personality traits and preferences of that individual. In another example, Kevin Mashford received the donor heart of a man who died in a cycling accident. He since went on to develop a passion for cycling. Another compelling story, Bill Wall, a hard-hitting top executive with a tight hold on his emotions. In the year 2000, he received a heart transplant at the University of Arizona. A few weeks after the operation, Wall heard a song by a star vocalist, Sade, an artist who he had never heard before. He says, I just started crying and rocking in response to hearing that song. He later contacted his donor's family and learned that his donor, Brady Michaels, had been a huge fan of the singer Sade. Michaels was a Hollywood stuntman who died in a freak accident. Wool became a competitive athlete, winning numerous medals among the transplant trials. More than a new heart, an 8-year-old girl received a heart from a 10-year-old female murder victim. The recipient child suffered dramatic post-operative nightmares about the murder of a young girl. The dreams recurred and were taken seriously by her psychiatrist, who perceived them to be genuine memories from the donor. The details in the dream proved to be so accurate that the information resulted in the arrest of the murderer. All these very compelling stories about what may be contained in someone's heart and what someone's heart may in fact contribute to their overall well-being and their emotional experience and almost to the activities of their brains does present us with a very curious question. What if someone were to receive your heart? And the question for us to consider is your heart wired with positivity and strength and vitality? Is your heart coaxing the most life and performance from every cell of your body? And how can we program and fortify our hearts for optimal quality of life, performance, and longevity? This is harnessing the mind-body connection, integrating it deeply into every structure and cell in our body to give us the highest quality of life, best performance, and optimal longevity that is possible. If only we had a systematic way to do this. And we'll talk about what might be possible. So receiving personality and identity from organ donors, there's a potential scientific basis. Researchers in this area have offered explanations that are very plausible. All systems in the body, including the brain and heart, have feedback loops which process and transfer information back and forth. Because of the feedback loops, the heart is able to store energy and information for the same reason the brain does. The prediction is that memory exists in every heart. The question is what percentage of people who receive a heart become aware of that information or are significantly influenced by it compared to the power of their own memory. So a very physiologic basis for what otherwise has somewhat of a creepy flavor and we see that we don't need voodoo or something else strange to explain this. In fact, those organs do contain that neurologic information which can be transferred to an individual by very physiologic means in the setting of, say, a heart transplant.